You're watching Aurora 8, proud to be serving Aurora, Colorado, and all America City.
Each year, hundreds of people die on the roadways of Colorado because of alcohol-related impairment. The numbers are grim and shocking, but as bad as they may be, there is another category of preventable deaths that often takes double the number of lives in our state, and that's prescription drug abuse. It's become almost an epidemic in our country, and Colorado ranks near the top. We are fortunate to have experts with us tonight from our University of Colorado Skaggs School of Pharmacy at Fitzsimmons. They will tell us everything we need to know about the growing health problem of prescription drug abuse. You don't want to miss any of what they have to say. That is coming up next, right here on Dateline Aurora. Greetings and welcome to Dateline Aurora. I'm Adam Dempsey. The number of those abusing prescription drugs in our nation has gone up by 500% in the last 6 years. Colorado has the sad distinction of ranking number 2 in the country for prescription painkiller abuse. Now, statistics like these make it more likely than ever that either you or someone you know is being affected by this health epidemic. Joining us tonight are 2 experts on the subject, students at the University of Colorado Skaggs School of Pharmacy who have made it their mission to educate the community on this serious and important health issue. Joining me tonight are Laura Vriesman, a third-year pharmacy student who has a bachelor's degree in medical sciences. Welcome to you.
Thank you.
And joining her is Jeremy Boom, a second-year pharmacy student who has a bachelor's in chemistry. Yay! Also, welcome to Dateline Aurora. Chemistry, I couldn't do any of that. This is much too complicated for me. Thank you for being here. All right. We are going to do things a little differently tonight. As I understand, you 2 ladies have a presentation that you're going to be doing for the audience. But before we get to that, I think our audience needs to understand more about your education at the Skaggs School of Pharmacy. Say that 3 times, Adam. The educational qualifications to become a pharmacist are really, really quite high. Yeah. You both have pharmacy, or will be getting your pharmacy doctorates, a PharmD, as Correct. They call them, right?
Yes.
It's got to be tough to do. How have you found time to do studies and do this research that you're going to be presenting today?
Luckily it's in the summer, and we are just really passionate about it, so we wanted to make sure that people were informed.
Mm-hmm. And yeah, it's really just a part of the problem that pharmacists face every day, so involving yourself in it is really important.
Really? So we Americans, we have issues with our medications. We pick them up at the store and we take them home, and sometimes we leave them out, we don't, and so that's become a bigger issue than I guess a lot of us know anything about.
Unfortunately.
Yeah.
Yes, absolutely. Yeah. I heard a police officer say that the war on drugs, he doesn't like referring it to as the war on drugs because wars typically have a beginning and an end, and prescription drug abuse doesn't really have an end, so prevention is what we're all about. Prevention
there. Now, I remember once upon a time, or maybe they still have them occasionally, they have a proper disposal. Becomes an issue, and they'll invite people to bring their out-of-date drugs so they can be properly disposed of. So is that still going on? Is that still a big issue, or are people still trying to dump them down the drain?
Actually, yeah, the FDA holds drug disposal events twice a year in Colorado, so you can bring your controlled substances and dispose of them that way. They also recommend you can crush them up and put them in kitty litter, or just throw them in old coffee grounds and throw them away.
Wait a minute, prescription drugs and kitty litter?
Yeah.
You're kidding.
No,
it doesn't hurt the cat?
No, after, when you throw it away. So you get kitty litter and you crush it up, and then you put that and you throw it away.
Oh, you throw it away.
Yeah.
You don't let the cat.
Don't let the cat in.
Oh, okay. Just thought I'd better clarify that before the Humane Society, everybody starts
exactly.
calling us about that.
It's you buy kitty litter and then you throw it away after you put your unused or old medications in there. A lot of people keep medications around just in case they need it later on, and we're really trying to break that habit.
Who's abusing the prescription stuff? Adults, teenagers?
Yeah, adults and teenagers, we really focus on educating parents of teenagers because the problem has become much more prevalent among that population, middle school to high school.
So how can a parent understand or see some warning signs that their teenager may be abusing prescription drugs?
There's several, it depends on the drug, maybe that the teenager is abusing, but there's some overarching warning signs or red flags that we typically look at. First of all, if your family has any genetic component or if you have a family member who has a predisposition to addiction, that's a big warning flag.
Yeah.
Mostly looking at personality changes. If your teen was normally real outgoing and social and happy and they start to become reclusive, that's a big red flag. If they aren't involved in the activities that they normally enjoyed, just really personality changes we look for.
I kind of got ahead of myself, but I wanted to get the parent information there to lead into your presentation. You have a presentation for us, right?
We do.
Regarding it. So we set that up properly so I can give that to you because I'm going to take some notes and learn something as well.
Well, thank you.
Fantastic.
Yeah, so as you mentioned, Colorado unfortunately has a lot of negative statistics associated with it in terms of prescription drug abuse, specifically amongst teenagers. 1 in 4 teens has reported to abusing a medication, and 1 in 4 is a really big number, so that equals about 5 million teenagers. 1 in 5 of those teenagers is usually under the age of 14 when they try meds. That's a really young person, and that's overarching principle for prescriptions. If we narrow it down and look at one specific med, stimulants, 1 in 8 teenagers has abused a stimulant.
And then we talked to these teens and we asked them if their parents had talked to them about prescription drug abuse, and only 16% said that their parents had talked to them about abusing a pain medication, and sadly only 14% said they had talked about abusing any medication. And this is really tough because 56% of those students, or those teens, said that they got the medication from their parents' medicine cabinet, and or their friends or other families' medicine cabinet. So it's a really big problem that parents really need to start having an issue with.
Yeah, and when we start looking at the reasons why teenagers abuse, that's one of them. So prescription medications are all easier to access than alcohol. You don't need a fake ID and you don't need a friend to go pick it up for you. You can just go straight to your medicine cabinet. So that's one of the main reasons teenagers are kind of going more towards the prescription drugs. If you survey teens and ask them what the #1 reason is, the last survey conducted said stress. And we normally don't associate teenagers with having the same kind of, especially under 14, no kids, cars, jobs, things like that to worry about. But that doesn't mean that the stress isn't there and it isn't very dangerous also. So school extracurricular activities are really big stressors, and we just like to point out that the stress doesn't necessarily go away and life doesn't get any easier for these teens. So prevention techniques are important.
Yeah, and so there's 2 major differences between the adult brain and a teenage brain. Believe it or not, it's not what you teach them, it's how you teach them, because there's 2 parts of the brain that really dictate how we act in our responses and our behaviors. You have what we call the nucleus accumbens, which is responsible for our impulsive behavior, our risky behavior, that immediate benefit and rewards that we get, and then there's the prefrontal cortex, which is more for the long-term gain. It kind of says, stop, think about this action, conservative behavior. And believe it or not, in teens, the prefrontal cortex is underdeveloped. It's not quite developed yet. And so really, they're just running off their decisions off the nucleus accumbens. So again, like I said, it's not what you teach them, it's how you teach them. So there's 5 most commonly abused prescription drugs. Narcotic pain relievers are the most common, and we've seen a rise in stimulants. And these people take because they perceive that they can concentrate better. And so these are the 2 that we're going to mostly focus on today in our presentation. But there's also sleep aids, sedative tranquilizers, and cough medicine, believe it or not. People don't think of that one, but sadly it prompts thousands of emergency department visits every year. So we're going to talk about narcotic pain relievers first. Like I said, it's really the most common abused drug, and it kind of helps by it just inhibits receptors in the body so you don't feel that pain, and it's abused to help relax and just forget your problems, and so people abuse it for that reason. Mostly teens are exposed to this drug when they get their wisdom teeth out. Any dental procedures are usually where they start, and they get a Percocet or a Vicodin, and that's usually where it starts off. And you start with those guys, and then they start to increase. With narcotics, your body develops a tolerance to them, and so you constantly need to increase the dose, and so the Percocet and the Vicodin don't work anymore, so they increase to OxyContin, and those are about $20 for one pill on the street.
Pricey.
Exactly, yeah. And so then, like I said, you have to keep increasing the dose. So as you can imagine, it gets very expensive. So this may lead to teens starting to use heroin instead, because it gives the same similar effects and it's cheap. On the slide, you can see that we show the chemical structure of both, and they are almost similar. They're super alike between heroin and OxyContin, and so you can see that the addictiveness is there in the OxyContin. It's great med if you need it, but if you don't, it really can be dangerous. Mild use of this can cause some side effects, such as constipation, depression, and even problems concentrating. But when you think of abuse or misuse, you don't think of mild use, you think of excessive. So some excessive side effects can be respiratory depression, so your teens can stop breathing, they can go into a coma, or even death. And this is really dangerous because a lot of teens use these while they're using alcohol, and that just doubles the effect, and we don't want that to happen. So.
No. And then the second end of the spectrum, we talk about stimulants. And stimulants are medications that are prescribed to a teenager if they have a diagnosis of ADHD or ADD. And the most commonly abused ones are Ritalin and Adderall, is what you'll hear. And the way that these medications work is your brain normally releases chemicals on a daily basis, but when you take one of these medications, it releases it in excess. So think about the difference between whispering into a microphone and shouting into one. And a stimulant is like shouting into a microphone. And misuse is, when we talk about misuse of these, it's taking a higher dose to achieve like a feeling of euphoria. And these are really dangerous meds because they're usually taken in conjunction with others, so alcohol or sleep aids, things like that. Yeah. And when you take it with alcohol, that's when we really start to worry. In the past 5 years, emergency room visits have doubled because of stimulant use. And if you have a patient comes into your hospital and you do a talk screen, if they've come in for stimulant use, you'll usually find another substance also having been abused, usually alcohol. If you have a glass of wine and you get nice and sleepy afterwards, that's your body's natural way of kind of shutting you down. But when you take Adderall or Ritalin and you're able to stay up longer, now you're able to drink more. You're able to drink 83% more on average when you take Adderall or Ritalin. So you can imagine alcohol poisoning is a really big player when we talk about this. College students are twice as likely to take a stimulant as opposed to a non-college student age. And some of the reasons that teenagers choose to abuse these medications, the most common reasons are all these all-night study sessions. They have the ability to stay up later, study more material. That doesn't mean they're absorbing it as much, but they're able to read more. Another common reason that they take it is to stay up longer, to drink more alcohol. Some teens believe that it'll help cause weight loss for them. And this is a tricky med because we see encouragement from parents and peers when they're taking this. So drugs they're considered to be more safe. They don't think they're going to be getting in as much trouble because they came from a pharmaceutical company and then they went to the pharmacy, and they're safer. They're pure substances, so they're perceived to be much safer. But if we look at some of the side effects that you can exhibit when you take these, first of all, you'll see a lot of nervousness and maybe some anxiety. You're taking it to stay up longer, so insomnia usually. Over time, as you abuse these medications, is when the real problem comes with a loss of reality and those personality changes that we had talked about. So this is a great med if you have ADHD, but if you don't have that diagnosis, then it's not safe to use for the reasons that we had cited. And it's kind of a touchy subject, but if you don't have that true diagnosis and you're just using it for a behavioral problem, then you shouldn't be using the medication at all. That's what we like to preach.
Really?
Yes.
Wow.
So we're just going to talk a little bit about what parents can do to help prevent this. And it's really just 2 simple steps. 1, we want to tell parents to safeguard all of your medications. And 2, just talk to your teen. So how to safeguard your medications. we as pharmacists like you to monitor every medication you're on. So write down what you have, why you're taking it, and the amount that you have. Really, you're only going to get 30 to 60 pills at a time, and so teens can't take 10 to 20 without you noticing. So they're going to take it slow and low. So they're going to take like 1 to 2 at a time. So we encourage you to write down all your numbers. So if you get 30 pills, write that you got 30 and then subtract every day that you take it, just so that you're aware of how much medication you have still.
Yeah, yeah.
So, and then control access. We really like to stress that as well. We like to tell our patients the 7-minute rule is key. So what that is if anybody's coming to visit your house, a neighbor, you're hosting a party, your friends, anybody's coming into your house, they can't find a medication within 7 minutes. So a lot of people put their medications in their medicine cabinet, in their kitchen counter, on the kitchen shelves, anything along those lines. Those are common places, but those are where people look most often if they're going to take some for you. So if you have a party, if you're having people over, control that access. We brought some lock bags. You can buy lock bags and you just put your controlled substances in there, zip it up, you lock it, you can have an actual key or you can have a padlock, and that can just further make sure that your medication is not open to everybody. Also, you have to tell your family and friends to do this as well, because like we said, 56% got it from either their parents' medicine cabinet or their families or friends. So as sad as it is, but sometimes their grandparents are on a pain medication for their arthritis or something along those lines. And the teens know that, and so they go and they'll steal from their grandparents. We don't like to admit it, but it happens. And so you really want to make sure that everybody's on board with this, that everybody's doing the same thing. Like we mentioned earlier, dispose of old and unused medications.
Into kitty litter.
Into kitty litter, exactly. You can do that. You just make sure it gets out of the house if you're not using it. We don't want you taking expired medications. We don't want you taking something. Just having it there just poses in a situation where you could use it inappropriately. So just get it out of the house. Like we said, we have those. The FDA holds 2 drug take-back events every year that you can bring your controlled substances to and get rid of them that way. Or you can go to the Colorado Health Department online, and some pharmacies actually can take back the non-controlled ones, but you can find those locations online.
So you can actually talk to somebody and see which ones they'll take back and which ones you throw
It's
in the kitty
mostly
litter.
just the controls that you have to take to the drug take-back events.
Yeah, those are the ones we're real worried about.
So where does the parent get the bag with the key that you were talking about?
Yeah, so
yeah, we actually have that with us.
Oh, you do?
Just, yeah.
Props.
Yeah, yeah.
Alrighty.
So you can just get it
That's
online.
what it looks like. And it has a combination lock.
Yeah, so you can
Or-
either
or
have
has
a
a key.
key
lock.
Yeah.
Yep.
And you
this
can
is
buy them
lock
online. This one was donated to us by Peers Assistance Services, but you can just go online and search like lock bags for medication, and these will pop up, and they're fairly inexpensive. There's different sizes that you can use to determine how much medication you have that you need to control access to. So they're really easy, and we really recommend them if you have controlled substances.
Wow. You were saying that a lot of students, a lot of teenagers use them so they can stay up late and study and that kind of stuff.
yes.
Do they get the idea or the encouragement to do it from maybe a classmate or something?
Well,
Or-
it's pretty commonly done, and like we said, it can be encouraged from parents and peers because competition with grades is so stressed usually, especially when you're in high school getting ready to go into college. You need to do well on those ACTs and SATs. So you get a lot of encouragement from fellow peers and parents. And like I said, they don't think they're going to get in as much trouble because it came as a prescription.
And that's really why it's important to talk to your teen. So
Yeah, I don't know. You know, we talk a lot about teens and how teens abuse, but adults do it as well. I guess to manage the stress of work
Yes.
and that kind of thing. How should an adult finally admit to themselves that they have a prescription drug issue? Because you have some that'll say, well, yeah, the recreational stuff I know I'm not supposed to do, but my doctor gave me the prescription. Anytime I want one, I can have one, but I don't have a problem with it.
Well, we like to talk about the difference between what's misuse and what's abuse, and they're not necessarily words that we like to interchange because they're totally different. if you get a prescription for Vicodin after you got your teeth pulled and now your mouth doesn't hurt anymore, you continue to use that medication, say for knee pain, or you're taking more than what the doctor wrote, or you're taking it more frequently than what they write, we consider that to be misuse. And then when you talk about abuse, abuse is my brother gets his teeth pulled, I take his Vicodin to get high. And those are the big distinctions. So a lot of times I think adults have a hard time putting themselves into one of those categories because it's a very taboo subject. And there's so many resources, and we're fortunate as pharmacists, pharmacy students, to hold a lot of those resources for adults and teenagers, anybody in the community, to direct them to some help.
Okay.
Yeah.
You brought some slides with you, I think?
Yeah.
To illustrate some of these points that you were talking about?
Yes, that's correct.
We did.
Okay. And I guess in the sequence, what's the first point we need to make again?
Safeguarding your medications.
Safeguarding medications. Safeguard all of them. Control the access. Do things along those lines. And then talking to your teen.
All right. And the next one would be?
Yeah, and so talking to your teen is the second kind of bullet that we like to talk about. So Peer Assistance Services and Drug-Free America, or the anti-drug campaign, gave us lots of advice because this is a really taboo subject, and it can be really uncomfortable when you're talking to especially like a moody teenager about it. So establishing those really clear ground rules in your house and then leading by example, being a good role model is one of the points that they make. Talking about how the risks outweigh the benefits. And unfortunately, I think a lot of times your teen might know more than you think that they know. So establishing what they're finding out what they know and then establishing that as a baseline for conversation is what they recommend. And you should be listening as much as you're talking. Making this a very free-flowing conversation and just being able to have an actual conversation with them. And what can come up is if you did drugs at their age and they ask you about it.
Oh gosh, I bet it
well, how do you deal
gives
with
a lot
that?
of parents very, very sweaty palms.
Yes, so the way that the drug-free or anti-drug campaign recommends to do that is remember it's not about you and that it's the teenager that you're most concerned about. So you can say too much. If they ask you a question, answer it honestly. You don't have to overindulge in your answer, but answer it completely honestly as trying not to lose their trust.
And as you said on the slide, trust is the key. It's better to have trust than to try to look good as a parent and say, well, you know, I kind of didn't, you know. Oh yeah, of course. And how can your pharmacist help?
Yeah, so we really we're able to identify any medications. A lot of them have special markings on them. So if you find one that you're unsure of what it is, you find it in your car floating around or in your teen's car or on their dresser, something along those lines, you can bring it into your local pharmacy and your pharmacist can actually identify what medication that is, what strength it is, and they can tell you what it is usually used for as well.
So now, being a crafty parent, should the crafty parent maybe take one dosage in to see, or do you tell them to just take the whole darn thing in there to find out because of the information on the label?
If it's not
because you know the teen's going to show up and say, "Hey, where's my stuff?"
That's true.
Okay.
You can just call us too. You don't even have to take it. You can just write down the information,
what it looks like, and things along those lines.
Yes, we're the drug experts, so we're always available to answer questions. And if we don't know the answer, we can look it up, and we have all of the resources available to do that, which is fortunate.
And so they can also go online and find the info as well too, right?
Yeah, absolutely. There's
you have another one too, another summary.
Yeah, it's just a little summary.
Yeah, everything is on the rise, and parents play the critical role again.
Yep, and like we said, we talked about there's lots of prescription drugs that teens can abuse, but we only talked really about the main two, which are painkillers and stimulants. And just we want to encourage the community to realize that this is a huge problem, and by safeguarding your medications and talking to your teen, we think are the two most important prevention strategies. Now,
are those two that you've talked about, are those the ones that are most prescribed? And that's how come the abuse of them is so easy to do, because they're just around?
I don't know if they're most prescribed, but they're known for what they can do for you. Yeah, these are just some things to remember. There is help out there. Parents aren't alone. Sometimes it seems really scary to deal with this alone with your teen. You're not alone. If you have any questions about our presentation, or if any parents do, they can email Jeremy or I, or we got a lot of our information from Peers Assistance Services, and Lori Lovedale has been a fantastic resource, and she's helped us. So if you have any further questions, they can go and ask her.
Well, maybe it's hard for the parent to admit their child is doing it, and
Exactly.
that's why they don't.
And that's why it's really important to keep that open line of communication. All it takes is once. You know, we don't know if you have a genetic predisposition to being addicted to certain medications, or, you know, sadly, all it takes is once for it to be fatal. And it's about their child's future, so it's really important. No matter how awkward of a conversation it is, no matter how much the teen rebels, I know it would have been a very awkward situation for my parents to talk to me about, but it's important. It's on the rise. They're gonna be exposed to it, so it's really good to start that communication and make it not such a awkward topic.
Is this becoming worse because America is an over-prescribed country? We go to the doctor and ask for something for everything, and some of them oblige because they want to make sure they don't get sued later for some reason. So are we over-prescribed? And this is going to make it worse the more Americans go in for a prescription to take for everything that happens to us.
I think it's pretty multifaceted, and there's a lot of dimensions to it, and I agree that that's one of the reasons why. And teens are just realizing that they're easier to access. Like I said, you can all you got to do is go into a medicine cabinet to get them. And so I think the reason is pretty deep why, but you're right, that's one of them.
Yeah.
And they think it's safer, like we said earlier. They think, okay, well, a pharmacy company made this, someone prescribed it for a certain, people take it all the time, it's easy to get to, it's safe, we know where it's come from, we know what's inside of it, so it has to be okay to not abuse this one as opposed to going on the street and abusing cocaine or heroin or something along those lines.
Yeah.
They think it's more acceptable.
At the risk of being redundant, but also sometimes you need to underscore these things again. What are the warning signs again the parent can look for?
We're looking at personality changes.
Personality changes.
Yeah, we're looking if there is a family predisposition to it, habits that are starting to change.
Predisposition means somebody else in the family has been doing it, and
Yeah.
so they could have picked up the habit.
Some abuse of some substance.
Right.
It can be alcohol, it can be drugs, but if there is a family member who has an addiction problem, if they're an alcoholic or if they're a drug addict, then there is a genetic link to that. So that would just raise a red flag, and that doesn't necessarily mean that you have that same genetic compartment of you, but it's just something that you might want to look for.
Yeah, okay. And then again, where they can go to get help, they can call the University of Colorado.
To get help, if you think that your teen does have a prescription drug problem, you can go and talk to your primary care physician. That is always a great resource. Also, we have this brochure. It's for linkingcare.org. So you can go in, and if you think your teen has a problem, you just type in your zip code and they can get you a treatment or rehab facility center right around your area. So it's very important to recognize that this is a problem and get your teen help.
The brochure is linkingcare.org.
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 Yes.
That's nice.
Yes.
Well, Laura Vriesman and Jeremy Boom. See, I knew I was going to say that when I was over. Hey, we thank you for taking the time to come to us and bring to us this very important information, that's for sure. And best to you both.
Thank you.
Getting those PharmDs.
Thank you.
Hey.
Thanks for having us.
That's for sure. That's all the time we have for this edition, and we thank you for joining us as well. And make a note to connect with us again for our next Dateline Aurora.
You're watching Aurora 8, proud to be serving the All-America city of Aurora, Colorado.